Good afternoon, everybody. Thank you for joining us for the GP Practice webinar that has been designed to show you how to manage your GPs in PCSE Online. My name is Debbie Roberts and I will be facilitating this afternoon's session. Okay, so we do have a real packed agenda this afternoon, but I'm going to start with the Perform List process overview. So it's basically a flow chart to show you the GP journey once they've submitted an employment change and where yourself and the practice are involved. We're going to have a look at user management in PCSE Online because that's super important to be able to do the approval side of things in PCSE Online and complete various forms. We're then going to have a look at the approvals process in PCSE Online. So I'll show you what it should look like and how you will go in and approve a perform list change that comes through. We're then going to have a look at the pension side of things and see how that links with the perform list process. So we'll have a look at the pension joiner forms and the pension leaver forms in PCSE Online. And then at the end of the process, it comes the estimate form. So we're going to have a look at that as well. And then at the end, I'm going to discuss approving Locum A forms in PCSE Online. Okay, so let's make a start then. So I wanted to start with the performer list overview. So you can just basically see what happens when a GP submits an employment change. Now, when a GP needs to make a change to the performer list entry, it's down to the GP to action that in PCSE Online. The practice can't submit the change and neither can the ICB. It all falls on the GP to do this. So what they'll do is log into the PCSE Online account, and then whether they are joining your practice or if they're leaving the practice or if they're changing role at the practice, everything will need to go through PCSE Online. Now, once a GP has submitted that request, it comes through to PCSE. And what PCSE will do is, we call it triaging. So basically, we'll have a look at the case and make sure that you guys at the practice have got the role set up and things, and we've got the correct email addresses so we can ping the approval request over to you. Now, how the system works within PCSE is when we accept that case, the system automatically generates an email to you at the practice. And then that's when we need you guys to log into PCSE Online and approve or reject the change. Now, as you can see on the flow chart, there's two different options. So we've got a salaried GP option, and then we've also got a principal GP option. Now, if it's a salaried GP, the approval process is quite simple because we don't need the commissioner involved. So what will happen is the GP will submit, PCSE will accept, it will come through to the practice. You will then log into PCSE Online and have a look at what the GP has submitted, just to make sure that the joining date's correct, etc. And then once you've approved that request, that then comes back into PCSE. We then contact NHS BSA and arrange for the prescriber number to be generated. And then at this point, that's when you can then go into PCSE Online and complete your pension joiner form for your GP. Then once that's been done, once you've completed the joiner, you'll then see that the GP will appear on your practice estimate form, and then the relevant pension deductions will be made from the practice and the prescriber costs can be correctly assigned. Now, the only difference in the process is when it's a principal GP. That's because we need the ICB to also approve the contract change. So once the practice have received the approval and you've approved the request, it then has the additional step of being approved by the commissioner. And then once approved, it then follows the steps that I've just discussed. Now, at the point where the case has been approved by the ICB and yourself, and we've received the prescriber number for the GP, now what will happen is for the GP to receive their prescriber number, when it's a salaried GP, once the case has been approved, we will ask the GP to check the PCSE Online account for the prescriber number. If it's a principal GP, we will actually send an email to the principal GP with the prescriber code included. So if you've got any GPs at the practice that aren't sure about the prescriber code, they can check the PCSE Online account. And if it's a principal GP, they will have had an email from us with that information on there. So this isn't the first time I'm going to show you this flow chart throughout the session. I am going to revert back to it just to show you where we are in the process. But before I do that, I'm just going to take a step right back and I want to start talking about user management in PCSE Online. Because like I say, if we don't have the correct users assigned at the practice, then a lot of these steps won't be able to happen. So it's super critical that you get your user management in order. Okay. So, to ensure the people at the practice have the correct roles assigned, it's really important that you first have the correct user administrators assigned at your practice. Now, these people are responsible for creating new users in PCSE Online, deactivating any existing users that no longer require access to PCSE Online, and it's also their responsibility to amend existing users' details. So, for example, if you need somebody to have additional roles because they're covering somebody that's off sick or on annual leave, or if you need to change the name because they've been married, something like that. I'm going to show you through step by step how you do this. Now, if you feel that your practice don't have the correct user administrator set up, we just ask that you contact us. So if you can email our portal inquiries team, I've put the email address on screen. So just to confirm, if you are a user administrator and that's the only role that you've got, you're not going to be able to action any requests that come through. So it is just the responsibility to manage other users. So if you do want to be actioning work that comes in from a GP, you're going to need to assign yourself some other roles. But I'm going to run through those now with you. Okay, so if you want to be able to action any performer list requests that come through, so i.e. you've got a GP joining your practice and they've submitted a request and you need somebody to assign it, to approve it, you're going to need the PL practice manager role. Now, this role is responsible for approving and rejecting any employment changes that come in. So without this role in place, any changes that the GP submits will not be seen or actioned, which then will essentially mean that the GP record won't be accurate. And then it has a knock-on effect that the pension contributions and things like that won't be taken from the practice. So it's super important that you do have the PR practice manager role in place at the practice. And again, if you've only got one person doing this role and you know they're going to be off work for 2 weeks if they're going on holiday, it'll probably be a good idea just to make sure that you assign somebody else that role, just so you've got somebody to cover that work. Now, when a GP has submitted an employment change request and PCSE send the email over to you, the email will be sent to the practice email address, and that's the main email address for your organisation. It's not the PL practice manager that receives the email for that. So just make sure that you keep an eye out for the email that comes in. But again, if you're the one that's got this role and you're responsible for approving any GPs that are joining the practice, if you know that a GP has submitted an employment change, it's just good practice just to go in and just make sure that you don't have any outstanding requests. If you do need to change the practice address, email address, you can also email the portal inquiries team and they'll be able to support you. Okay, so I'm now going to run through how you would create a user in PCSE Online. Now, again, this is simply for the user administrators. If you don't have the user administrator role, you won't be able to do this. It's simply just for those that are responsible for managing all the users at the practice. Okay. So to do anything in PCSE Online with regards to user management, you'll first need to log into your PCSE Online account, and then anything user management based is you'll need to click the user management button at the top. So as you can see here where I've circled in red, you will select the user management tab at the top, and then just to the left of that it's circled create user. So once you've logged in as a user administrator and you want to create an account, just follow those steps. And then what will happen is when you select create user, it will pop up a message asking if you wanted to create a performer. But in this instance, you can just select no, because 9 times out of 10, it's not going to be a performer. It's just an admin of the practice. So you can select no at that point because they won't have a GMC number. And then once you've selected no, you'll get this screen that's come up with all the blank details in there. Now, you will see that the request to email is in grey. Now, you won't be able to change that box because that'll be your email address that's in there as a user administrator. But what you need to do is just complete all the boxes that are in blue. And then that will, when you type in your organisation code, what will happen is it will pop up all the roles that are available to that user. So as you can see here, once we've inputted the organisation code, it'll give you a list of all the roles that are available for that user. Now, for this example, we are selecting the PR practice manager. So by selecting this role, that will mean that they'll be able to action approve or reject any performance changes that come through. So you just simply tick that role, and when you're happy, you've entered all the correct details for your user, simply click create, and then that would be your new user active on PCSE Online. Now, because you've given them the PR Practice Manager role, once they log into PCSE Online, they will have the Performer List tab, and then they will then start seeing all the Performer List approvals that have come through. But I'll run through that in a bit more detail later on in the presentation, just so you'll know what they'll see. Now, it may be that you need to edit a current user that's in PCSE Online. So again, you just follow all the steps by logging into your PCSE Online account and visiting the user management area of PCSE Online. And as you can see here, what I've done, I've just typed in test just to give you a bit of a demonstration. And then what will happen is if you put the user details in there that you're searching for, so if you need to say add some roles to someone else, you'll just put their details in there and then click apply. And then what that will do, it'll bring up all the details of that user. So it'll have the username, the surname, the first name. It'll show details of when they last logged in, if they've had any bad password counts, whether the account's deactivated, expired, etc. Obviously, this is just for demonstration purposes, so I am showing you a deactivating an account, but like I say, majority of the time it will be active unless you've gone in and deactivated that account. Okay, so if you need to edit that user, you just simply tick the edit user box. And then what will happen is it will bring up that user's details. Now, unlike the other screen that I've shown you, you will actually see information in this area because they're already an active user in PCSE Online. But in this section, you'll be able to change things like the surname, the email address or the telephone number, along with assigning or removing roles as required. So what you need to do is if you want to add or remove roles, just scroll down the screen, select the roles that you want to add or remove, and then simply click update. And then that will have updated your user's permissions or details if you've changed the name, etc. So there is also an option in PCSE Online if you wanted to view all the user accounts that are attached to your organisation. To be honest, it's good practice to probably do this quite regularly, especially if you've got a lot of staff that work at your practice and you've got quite a high staff turnover. It just ensures that the people that have got accounts at your organisation should still have them. I suppose it's just good practice just to make sure that you're keeping on top of who has actually got access to what in PCSE Online. So in order to view those that are attached to your organisation, again, you just visit the user management tab. And then if you scroll down to the My Organisation Only box, and then tick that box and click apply, this will then display a list of all the users that are within your organisation. This will also show deactivated accounts as well. It will show everybody that is linked. Now, if you have a user that is no longer active or works at your organisation, then you will need to go in and deactivate their account in a different area, but I'm going to go through that shortly. But you'll see on this screen here, you'll see a list of all the usernames, and then you've also got the option to edit the user. If you click edit user, it'll just go through all the steps that I've just previously shown you. So it'll just pull up all the details of that user, and then you can go in and edit any names, any personal details, email address, and add and remove roles. Okay, so it is really important to make sure that you do keep on top of deactivating any users that have left your organisation, or if they no longer require access to PCSE Online as soon as possible. Now, any leavers that move to a similar organisation will most likely use the same email address. So it is really important that you remove their access to your organisation as soon as possible, especially because PCSE Online is accessible anywhere on devices that are connected to the internet. So say, for example, if you've got a colleague that's leaving your practice, say they're moving house to a different town and they've got a job lined up at another GP practice, if you haven't deactivated them from your organisation, chances are they're using the same email address. Once they get set up at the new organisation, they'll still be able to see all the details of your organisation. So hence why it's really important just to make sure that you remove that access from them. Chances are they're not going to do anything with that information. However, there is a high risk that they could tamper with information, and it's also private and confidential information that shouldn't be shared across different organisations. So again, super important that you just keep on top of deactivating your users where necessary. I'll just quickly show you how to do that then. It's really simple. And again, log into your PCSE Online account, visit the user management tab at the top, select deactivate user, and then in this blue box here, you'll just put the name or the username of the user that you wish to deactivate, and then select deactivate user. Now, when you select deactivate user, it will pop up just to confirm yes or no. Don't worry if you deactivate a user incorrectly. You can sort that, that's fine. Or if you need to reactivate an account, all you'll need to do is search for the user in the Update User tab, open that user up and just reassign those roles. And what that will do is reactivate that user for your organisation. So like I say, don't panic if you have deactivated somebody by accident. It's easy to rectify. But it also shows you as well, say like if somebody goes on maternity and you know they're not going to be working at your practice for 12 months, again, it's good practice just to take the access off them because you don't know if they're going to return. And while they're at home, they don't need to be able to have access to your details, your organisation's details. So like I say, good practice just to keep on top of your users. Now, the same applies to assigning roles as well. Be mindful when you are assigning roles, you don't need to go in and give everybody every single role for the work that they do. Now, reason being is, number one, it'll clog up the work queues. If you've got somebody that's just working pension related processes, you don't need to give them performer lists if they're not going to be actioning those changes, and vice versa. And at PCSE, we also use the PCSE Online user roles for other things. So, I mean, I work in the communications team at PCSE, and when we need to send out vital communications to people at the practice, we do it based on the roles that they've got in PCSE Online. So, say, for example, we need to share some information with the practices about end of year processes. What we'll do is we'll pull a report to see what users have got what roles, and then we'll pick out all the pension roles and only send the relevant communications to that group. So if you don't have those roles in PCSE Online that you'd like some communications to, you won't get them because you don't have the roles. However, don't just assign those roles just to get the communications. There is another option that I'm going to show you in a second if you do just need roles for communications. But again, it's another reason to not provide everybody too many roles because they're just being inundated with communications that they have no interest or desire to read because it's not part of their work that they do. So with that in mind, if you do want to receive communications from us, but you don't want to give yourself the role in PCSE Online because you don't need the role, you can visit the PCSE website. And basically, if you visit the news section, and then when you scroll down to the bottom, you'll see there's an option to subscribe. Now, when you select subscribe, it will prompt you with a form, and you just need to complete all your details. It'll ask for your email address, possible organisation code and things like that. And it will also just ask you to choose which communications you've got a valid interest in. So yeah, so you can start getting communications that way. So I'm now going to discuss performer list employment changes in PCSE Online. We want to just show you first what kind of approvals you are going to be getting in PCSE Online. So this is basically once a GP has submitted a request. Now, the various requests that you will receive are if a GP is joining your practice, if you have a GP leaving your practice, if you have a GP that's changing role within the practice, so if you've got a salaried GP that's going to be a principal GP because they're now a partner at the practice, or vice versa, they'll have to submit that through PCSE Online. Withdrawals will come through PCSE Online. So if somebody's resigning or retiring from the practice, we'll also receive 24-hour retirements. But again, just make sure if you want to see any of these changes come through to PCSE Online, you must have the PL Practice Manager role. If you don't have this role, you will not see any of these requests come through to your tab. Okay, so I'm now going to show you how to approve and reject performer list requests in PCSE Online. But just to note, the screen that you see here may be different to what you see on your screen when you log into PCSE Online. So as you can see, we've got the performer list tab and I've got a records and supplies tab. It may be that you have a pensions tab and a payments tab. It may be that you don't have the performer list tab. If you don't have the performer list tab, that would indicate that you don't have the correct roles assigned to you if you wanted to action any performer list changes. So that's another way to see whether you've got the correct roles in PCSE Online. Now, if you know that you're responsible for actioning performance requests, but you don't have this tab, speak to your user administrator, who will then be able to follow the steps as I've just previously shown, and they'll be able to assign all the required roles for you. Okay, so if you want to be able to find your perform list requests that have been sent in through the GP, once you have logged into your PCSE Online account, you can either select the blue perform list tab at the top of the screen, or you can scroll down to the green tab there. Either will take you to the correct area, so whichever one you select is fine. And on this page, to view any approvals, you will need to visit the activities queue. And then once you have selected this, it will bring up all the awaiting approvals that you've got at your practice. In this example, we've just got the one outstanding approval, but this is, like I say, it's just for demonstration purposes. It may be that you've got more than this, or you don't have any. It all depends. Every practice will be different. It all depends on whether you've got any outstanding requests that GPs have submitted. So on the request, you'll see that there's a case reference number. You will have the performer name, what role they're applying for, and the task. So as you can see here, this is a change of practice, a gain in practice. So that would indicate that a GP is wanting to join your practice. It also shows you the status. So as you can see here, that's pending, which would then indicate that the practice needs to do something, i.e. go in and approve or reject the request. And it also shows you the date submitted by the GP. Now, there is just one thing I wanted to point out, and I know we do get quite a few queries about this. Depending on what size the screen you're working on, sometimes you won't see some of these requests, so your screen might be chopped off halfway through. I work on quite a big monitor because I do a lot of presenting, so that means that my screen's bigger and I'm able to see the full screen. But if you find that when you view your activities queue and you can't see everything, there is a scroll bar, so just move that scroll bar across and you should be able to see all the details going forward. Okay, so when you're ready to review the change, if you select the practice change button, what will happen is it will open up the request in a bit more details. So you'll see the practice name, again, the role that they're applying for, the start date at the practice, and the performer name. Now, it's super important that you have a look at the start date, which is there, and just make sure that that is the correct start date, because again, they need to make sure that's right, because we're going to be including that in the joiner form, estimate form, and things like that. Because the performer list process is interlinked with pensions, things like start date is super important. So just make sure you check those details before you approve. Now, if you're happy with everything that the GP submitted, great, click approve. However, if you're not, select reject. And then what will happen is it will give you the option to see a drop down. Just click the little arrow and you'll see lots of options for the reasons why you want to reject a case. Now, there's various details on there, so if the dates don't match or the change is no longer going ahead, just select whichever reason it is that you're rejecting the case. Now, you'll see at the bottom, there is something that says Other. If you select that, it will open a free type box that you can type in there. So once you've selected your rejection reason and then select Reject, what will happen is the GP will then receive a notification that the approval to the employment change that they have submitted has been rejected, and it'll also provide the reason. And then obviously that GP can then go in and rectify any details that might be missing. So for example, if the start date's not correct, they can go in and rectify that, and then they can resubmit the request and the process will start again and the approval will come back through to you to approve. Okay. So like I said, I did want to come back to this screen just to kind of show you where we are in the process now. So I have just discussed the approval side of things. So this is this part of the flow chart. Now, in blue, that's where the practice involvement is. So depending on what you've just approved, so say like the example I've just gone through was a salaried GP. Perfect, you've approved the case, it comes back to PCSE. We're then going to contact NHS BSA, get the prescriber codes, pop them into PCSE Online if it's a salaried GP, and then you can complete your joiner form. Now, if it was a principal GP, you've just done your approval side of things. Fantastic, that's great. However, we then need to wait for the ICB to approve the request. Now, how NHS England wanted us to build the system where that the practice approved the request, and only when the practice have approved the request, it then goes to ICB for approval. So until you approve the request, the ICB won't be able to touch it. they have to wait until you've approved it at the practice first. So just have that in mind. If you do have any outstanding approvals, the ICB can't start their side of things until it has been approved by the practice. Okay, so there's just a couple of other functions in PCSE Online with regards to the perform list that I wanted to show you, because you might not be aware that they're there or how to use them. Now, you have the option to search for GPs that are included at your practice, and you do this by selecting the Performer Management tab. And when you select that, it will give you the option for you to search for your GP. You can simply just pop the GMC number in there, click search, and then what will happen is that will display all the details for your chosen GP that you've just searched for. And then if you want to be able to open an audit history for that GP, simply scroll down and click their name. Obviously, that's not a real name, it's just for demonstration purposes. But once you've clicked that, it'll open up an audit history and you'll see the audit history of the GP, basically. So if they've been approved, rejected, and certain dates and things like that. So all the information will be on there. If, for example, you search for GP and they've got an outstanding request, you'll also find that here as well. So within this example, there isn't one. However, if there was, it would say review practice change. And then if you click that, it will simply just open up the request as you saw previously, and then you can either accept or reject, as I've previously shown you. Now, in the same area, you also have the option to conduct an advanced search. Again, select Performer Management and then select Advanced Performer Search. And then where it says Performer Type here, you'll just scroll down to this part here and select the drop down and then select Medical and then select Search. And what this will do, it will give you a list of all the GPs that are associated with your practice. As you can see, you might have a long list, depending on the size of your practice. You might have a small practice that's only got a couple of GPs on there. Again, down this section here, under Action, you'll see if there's any pending transactions outstanding. If you wanted to review that, scroll over, just give that a click, and then you'll be able to action any request that's outstanding. Or if you want to have a look at individual GP's audit history, select the GP in question, and then that will pull all the details for you. So last but not least, for Performer List, you also have the option to review historical cases. And all you need to do is select the Historical Cases report. And by selecting that, you will then have the option to include a from date and a to date. So if you wanted to see how many GPs had any action on their account, so if they've been approved or rejected within a certain date range, this is where you'll pop the dates. So say like if you wanted the 1st of September 2021, you'd pop that in there up until today's date, pop that in there and then select search. What that will then do is display a list of all GPs that have had any action in between those dates. Now, if you want to be able to view a full report of that rather than viewing it in PCSE Online, all you need to do is select Download Extract. And what that will do, it will download a CSV file. It'll just be able to manage things a little bit easier. So just give you a bit of an example of what it'll look like for you. So it'll have the performer name, the performer type, the GMC number, the case type that was submitted, when it was initiated, the case completed on date, the status of the case, and then the case number. Okay, so that's all I wanted to talk through with regards to Perform List approvals. Now we're going to have a look at GP partners in PCSE Online. So GP partners in PCSE Online, one of the main reasons why you would need to include a GP partner in PCSE Online is if they are part of the pension scheme and they need to submit pension contributions. So if you do have a non-GP partner that joins your practice, it is the responsibility of the practice to include them onto PCSE Online. Now, it will be the GPP practice user administrator that will need to assign the role. And the role that the non-GP partner will need is the one here that's just shown on screen. So it's a GPP non-GP partner role that they're going to need. Okay, so I'll just show you what it's going to look like. Again, to assign your non-GP partner this role, just follow the steps that I discussed earlier about being able to create the account or an edit a user, So if they don't have an account, you'll have to create a full account for them. However, if they've already got an account in PCSE Online, then you'll just need to simply add the role. Now, this is obviously for those that are in the pension scheme, and you'll need them to have this role in order to be able to complete the joiner form, which we'll run through in a moment. Now, once you have assigned the non-GP partner their role in PCSE Online, they'll then be able to complete and submit annual certificates. They'll be able to submit an annual certificate completed by a practice accountant. They'll be able to view previous annual certificates, complete individual estimated income, view ABC applications, complete payment details relating to ABC lump sum contributions. They'll be able to opt out or opt into the pension scheme, and they'll be able to submit and view break-in service applications. They'll also be able to view employee contribution statements and complete an opt-out on behalf of a performer/NCP. Okay, so that was just a whistle-stop tour about non-GP partners. So I'm now going to have a look at completing the pension joiner form in PCSE Online, which is a next step the practice will need to complete once the perform list employment details have been approved, which I've just discussed earlier. So this will be the next step from that. So the pension joiner form must be submitted through PCSE Online to start pension contributions when a GP or a non-GP partner joins your practice. Now, your GP will need to be aligned to your practice in order for the form to be completed, hence the performer list side of things. And once the GP employment change has been approved, you will then be able to complete the joiner form. Now, if you're responsible for completing joiner forms in PCSE Online, this is the role that you're going to need. So you're going to need the GPP, joiners and leavers role. So like I previously mentioned, this step's kind of linked to the perform list approval process. However, it is a separate step that must be completed once the approval has been done by the practice and by the ICB if necessary. Now, if you're struggling to add somebody to a joiner form, sometimes we find it, especially if it's a newly qualified GP, we might not have the SD number on record for them. Now, that'll probably simply because NHS Pensions have been managing that performers' pension contributions when they've been a GP registrar. Now, if that is the case, then you just need to give PCSE a call with the SD number and we can get that added onto the system for them. And then once we've got that on record, you'll be able to complete the joiner form and all the other forms that will come after that. It is very rare, but if you do find that that is the reason why you can't add a new joiner, then just give us a call. It is probably just because we don't have the SD number on file, because it was NHS Pensions that created it originally and nothing's actually come through PCSE Online. Okay, so in order to find the pensions joiner form, obviously you log into your PCSE Online account, visit the GP Payments and Pensions tab, click pensions and then click on joiner and then select the joiner entry form. Now, we recently completed an estimates webinar for practice staff about 2 weeks ago, and my colleague Katrina went through and completed a joiner form during the webinar. So I'm just going to show you a quick clip of that.
Hopefully you will all be familiar with the joiner form itself. We get an option to select whether this is being completed for a GP or a non-GP. So thinking about that scenario with the pharmacist colleague, it would be a non-GP. And all that really happens in terms of the form is that it automatically defaults to the partner income type because they can't be salaried GP, can they? So that's really the only difference when it comes to the joining screen. Yeah, it is. So, but what you would be doing is entering for your GP GMC number is an easy identifier, but whichever identifier you want to enter. If we already have them set up with a pension scheme membership number and they've completed that employment change form and you've approved that at the practice, then they will be searchable here or selectable here. The details will auto-populate and then you're able to select the joining date. So because it's a GP, I need to confirm whether they're salaried or whether they're a partner, and it's really just a radio button, so you can click between the two. Your joining date, now this is really key. So the joining date now, the functionality in PCSE Online was enhanced quite some time ago now to allow you to enter a retrospective joining date that goes back as far as the 1st of April of the previous pension year. So that means where we're sitting at the minute on the 13th of March, if you've got someone who, for whatever reason, started with you even before the 1st of April 23, so they might have started with you in October 22 or something like that, you will be able to enter that joining date. Once we get into April 24, the earliest joining date you'll be able to enter and have the system do all the work for you is the 1st of April 23. So for anyone who might have, a GP that's been kind of lingering there and you've had problems getting them on your estimate last year, then if you complete this joiner form now, enter the date they joined you, then you will just have to be aware that when you get your contractual statements for the following month, then the arrears that are due for the months that they've worked for you bring up to date, all of they will be deducted in the next monthly contractual statement, and then after that it will be 1 month at a time, as you would expect. So that's something to bear in mind. But that joining date can be as far back as the 1st of April of the previous pension year. Your selections for your tier rates, the joiner form will be updated from the 1st of April 24 with the new tier rate table, but at the moment we're still in 2023-24, so we've still got the tier rate selections that you will be familiar with from this year, so 5.1% up to 13.5%. So we've got just some simple data to key in. One is the joining date, whether they're partnered or salaried, we need to select that. The tier rate, we need to select the tier rate that we're expecting the GP or to apply to the GP, and then we're entering the pensionable income for the GP. Now, that also here you see that there is a button or a box to enter any estimated solo income. But once again, you don't need to worry too much about that. The key thing is that you reflect the GP's expected total pensionable pay in terms of the tier rate that you select, as we said earlier on, just the same as you would with the estimate form. And then once you have entered all of that information, then you can just click tick to confirm and click submit. That comes straight through to PCSE. And as I say, the calculations in the system are automated, and so they will be applied on a going forward basis, but in terms of determining the monthly contributions. But if you've entered a date up there that is a retrospective date, 9 times out of 10 it probably is at least a little bit retrospective, then the system is programmed to calculate those contributions and bring them up to date. So I hope that helps you in terms of the joiner form itself. The difference for the non-GP, you won't have a GMC number to enter as an identifier, but you can use the SD number. You can try searching by name, but that tends to be a bit slower. But the SD number or the GMC number, if they're not being found when you try and enter the SD number here, it means one of two things. Double check that the user administrator has assigned that PCSE Online role before you go to do this, because they need to have done that in advance. And then when you go into the joiner form, if that non-GP partner that you've entered the SD number for, if the system's not finding them, it means you need to give us a call and get that added in. That's a one-off thing. Once that's done, then anything else you need to do in future, be it joiners, leavers, estimate forms for that particular colleague, you won't have any issues with that. So that hopefully gives you a bit of a flavour of the joiner form. The leaver, very, very straightforward in terms of just entering the GP or the non-GP partner and entering the leaver date, and that will then stop the deduction straight away, and the system will also calculate any backdated refund this time. So it might be that the GP actually left you in October last year. You put that date in today, and you'll find that in your next monthly contractual statement, you'll see a refund of the months that have been deducted between October and now, so that then means that the practice get back what they've overpaid.
There we go. So I just wanted to show that recording because Katrina's really good at going through the forms and just showing you a couple of things that will hopefully help you out. Now, I know Katrina mentioned the listing screen, so I just wanted to explain how you will find the listing screen. Now, what you'll need to do to find that is log into PCSE Online, click on the GP Payments and Pensions tab, click Pensions, click on Practice Joiner, and then select the Joiner listing, just as shown there on screen. Now, with regards to the listing screen, just be aware that it's only a view-only option, so forms can't be edited from here. If you do need to make a change for the current pension year, there is a salary change form, or you can go on the estimate screen and resubmit a revised estimate. If you've made a mistake in a historic joiner, you'll need to submit a contact us form to let us know the correct information. Okay, so I'm going to jump on to pension leaver forms now in PCSE Online. So if you have a GP leaving your practice, so the practice user with the GPP joiners and leavers role will need to complete the leaver form for that GP on PCSE Online as soon as you know whether a GP or non-GP partner is going to be leaving the practice. Now, completing the leaver form just ensures that pension contributions are stopped from the date of the GP leaving. So to find the leaver form in PCSE Online, again, it's really simple. Just once you've logged into your PCSE Online account and gone through the various steps, so your pensions and payments tab, click pensions and then click on practice leaver. Okay, so I just wanted to show you quickly what the leaver form looks like. So the practice leaver entry form can be completed with a leaving date in the current or previous financial year. Once you're ready and you've entered all the details, just click the submit button, and that's when the pension contributions will be adjusted in the practice's net contractual payment. So like I say, it's a real simple form to complete. You'll have the practice name already included and the date, and then you'll just go on and select from the drop down your GP that you want to include on the leaver form, include the leaving date, add the date, tick to confirm and click submit. So it's really simple to do that. And if you need to view any previous leaver forms or joining forms, again, the listing screen is going to be your friend for that. So listing screen, again, it's just for viewing purposes only. If you do need to make any changes, then you'll need to do the salary change form or resubmit an estimate form. Or if it's an historic leaver, then you'll need to contact us via the contact us method, which can be found on the PCSE website. So just to show you what the listing screen looks like then, so once you've opened it up through the relevant tabs that I've just shown you, you can just simply add your search details in. So add in either your GP name, GMC number, or the GP's SD number, add in the various dates, and then selecting search, and that will bring up all the relevant forms that you're searching for. Okay, so now going to have a look at estimate forms in PCSE Online. Now, this would essentially be the end part of this process that I've discussed. So I wanted just to show you that once you've completed your joiner, it then moves on to the estimate side of things. Now, if you skip this step, not completing the joiner form, then you'll find that they won't appear on the estimate form. So just have this in mind when you're completing things for a GP, that if they're not on the joiner, chances are the employment change hasn't been done correctly. If they're not on the estimate, chances are that the joiner's not been done correctly. Okay. So just an overview then of estimates in PCSE Online. So the annual practice estimates of pensionable profit should be submitted via PCSE Online. It's important that the estimate is as accurate as possible to avoid any large adjustments when the end of year certificates are reconciled. The PCSE Online estimate form pre-populates with all the details of all the active pension scheme members, meaning that all you need to do is just go in and enter all the estimated pensionable pay and contribution tier and click submit. Now, a salary change form should be submitted to PCSE Online if the pension scheme members' estimated income changes throughout the pension year. But like I said, we'll go through that in a little bit more detail in a second. Now, Just a reminder that the deadline for submissions for estimates is the 31st of March, so it is coming up quite soon. And if you need somebody to do those at the practice for you, just to make sure that they've got the GPP practice estimates and salary change roll. So I'm just going to show you another video now of Katrina completing the estimates form, which was recorded in the estimates webinar that we did the other week. So I'll just play that for you now.
Logged into GP pensions, and I'm just going to click the estimate button. So practice estimate, what you will see now is that you have the option to select the 24-25 year. And what you will see, and some people have pointed out that there are some GPs that they would like to or expecting to see on their estimate who are not there, and we'll come back around that again just to make sure it's clear enough what we need to do if that does happen. But for your GPs, you just like the NHS pensions form itself, then you have the different sections. So you have GP partners, you have salaried GPs, and then you have non-GP partners if you have any in your practice. So the form will populate with the GP details. So if we start with our first GP, then what we're looking at in terms of the key elements that you need to complete and the only columns that you need to really be concerned about will be a column that says estimated surgery pensionable income, and then it will be the tier rate income. So there is another column that you can add any other pensionable income into there, but as a practice manager, then it's not particularly expected that you would be privy to that information. So the important thing is that the tier rate that the GP feels is applicable to them for that year is the tier rate that you select, and the estimated income that is going to be earned at your practice. So let's just say Dr. Number 1, we're going to say 50,000, and I should have had the tier rate table at hand to check the correct brackets, but our GP might have a lot of other roles, and they know that they need to be paying a tier or on the highest tier. Now, what you will notice when you go to the 24-25 estimate form is that the tier rates have changed again, or at least they have changed effective from the 1st of April 24. That was as a result of another consultation by Department of Health and Social Care. So you'll find the tier rate table in the NHS Pensions website. So your tier rate, then you select the appropriate option. So there's a reduced number of options now. So let's just say our GP is on 12.5. Doctor number 2, then again, it's just what's the estimated annual income for this doctor, what's the tier rate that we expect for them, and so on and so forth. So all you are doing is working your way down the form, populating with the estimated income for the practice and the tier rate. You work your way down all of those, and then we will go to the submit button. So let's just put some more figures in to here. And the form itself, as you've seen there, it only gives you the option of the tier rates that will exist for 24-25. So there isn't any way that you can put in a tier rate that the system wouldn't be able to accept. Clearly, just take some time and care when you're putting the numbers in. I do recall one person last year calling up in a complete panic because they submitted theirs, and I think instead of 25,000, they might have put something like 250,000, or it might even have been another zero onto that, but we were very quickly able to terminate that submission, and they started again. Okay, and then we've got our non-GP partner at the bottom. So again, let's just select whatever tier rate we've got there. So that gives you a total of the estimated pensionable pay for the practice. Now, again, I'm sure that you all know, but what then happens when we've clicked submit on this, the system will automatically calculate and divide the annual pensionable pay by 12, and then it will apply the tier rate that you've selected on a monthly basis to that 1/12 of the income, and that will determine the employee contributions that are taken for your practice for each of the GPs. So divide their pensionable pay by 12, and then it will apply the tier rate that you've selected for that GP. It will also apply the 14.38% to that 1/12 income for the monthly employer contributions. And you'll see when you get your monthly practice statement, you'll see all of your individual GPs listed out. You'll be familiar with that, where you have a section for employee contributions and you have a section for employer contributions. So in terms of actually creating and submitting the estimate form on PCSE Online, then it is just as simple as that. So all we need to do is tick to confirm and then click submit. We get another chance to confirm that we are happy with the submission, and that's it.
Lovely. So I hope you found that useful with Katrina going through the form for me. Now, I just want to quickly touch on the salary change form that's available in PCSE Online. So when you need to inform us of a change of a salary, again, log into your PCSE Online, go through the various payments and pensions tabs, and then click salary change and click salary change form. So if you have a GP who is changing salary midway through the year, you can complete this form for them. Now, that's just for a salary GP. So if you've got a principal GP that's got a change of estimated income, it's good practice to submit a revised estimate. That will just ensure that correct pension contributions are being made, and then reduce the risk of any large adjustments at the practice once the GP have submitted their end of year forms. Okay, so I'm now going to discuss Locum A forms in PCSE Online. So locum GPs can pension the locum work by submitting Locum A and B forms through PCSE Online, and it is the responsibility of the practice to approve the Locum A form on behalf of the GP. Now, if a GP submits that Locum A form and it's not approved, then the GP can't submit the Locum B form. Now, I'm assuming you're aware, you might not be, but a locum has got to comply with a 10-week rule. So what will happen is if a GP has submitted a Locum A form through PCSE Online, it's come through to your practice, and PCSE will send a reminder notification, which will be sent to the practice's Locum approver role, so the person that has that role in PCSE Online, and we'll send that at 8 weeks. So it is really important that if you do have this role in PCSE Online, that you're responsibly going in and approving the forms for the locum GP, just so they can comply with the 10-week rule and be able to submit their pension contributions on time. Now, the locum approver at the practice will receive both an email and a notification in PCSE Online when a GP has submitted a request. But just to let you know that you are going to need somebody at the practice to be able to be on hand to approve those for the GP. So if you've got any locum GPs working at the practice, it might be worth just having a chat with them and seeing if they're looking at submitting forms in PCSE Online. And if they are, making sure that you've got the users set up correctly at the practice. And just as you can see on screen here, it's a GPP locum approvals role that you'll need to assign. And again, you'll just follow the steps as I previously mentioned on how to edit your user when you're adding and assigning roles. So it is relatively new that locum GPs are using PCSE Online to submit the locum forms. We've got around 900 GPs now that are using PCSE Online to submit forms, and that number is growing. Hence why I wanted to include it in the presentation, just to make you aware that we might have some GPs, or you might have some GPs that are wanting to submit via PCSE Online. Now, in the past year, we've seen a 10% increase in PCSE Online submissions for locum forms. So yeah, it's just good practice to get everybody set up at your practice to be able to assure that you can approve those forms. And I think probably makes life a little bit easier as well for yourself and the GP to do everything electronically through PCSE Online. There's no paper forms involved. So if you have GPs that aren't using it, it might be worth having a chat with them and see if they want to start using it. So I'm just going to quickly show you another video just to show you how simple it is to approve in PCSE Online. When a Locum A form has been submitted by the GP through PCSE Online, the practice Locum approver will receive a notification via email and in PCSE Online that there is an action waiting to be approved. Locum A form approval notifications are sent to the Locum Approver role in PCSE Online. If you do not have a Locum Approver at your GP practice, your user administrator can assign this role to you. Approving Locum A forms in PCSE Online is easy. First, log in to your PCSE Online account and click Messages. This will display your notifications and Locum A forms that have been submitted to your practice for approval. Click Review on the form you wish to approve. This will display the Locum A form approval screen. Here you can see the details submitted by the Locum GP. Check the details submitted by the GP are correct. You can then either reject the form and provide a reason why, or select Approve once you're happy with all the details that have been provided. Once you have selected your option, you will then click Submit. And then Confirm. Okay, so as you can see, it's super easy to be able to go in and approve a Locum A form. You just need to make sure that you've got the correct roles assigned to your users. Now, just before we do end the presentation, I just wanted to show you the area on the PCSE website where you can find more support for practices. I'll just quickly show you that now. I appreciate we are going to. We've got lots of information on the PCSE website. If you select Services at the top, then you can scroll down to where it says GP practices. And in this area, you'll see there's 3 different topics. So you've got managing payments, managing pensions, and managing performers. So just one example, we'll select pensions. And here you can see we've got lots of different areas of where the information is stored for you. So we'll have a look at the managing joiners and leavers. You'll see that it outlines the process briefly. And then when you scroll down the page, you've got the option to view a user guide, and then also a link that also takes you to our PCSE YouTube channel, where we've got lots of supporting videos available to help you out. Just going back up to the page then, so say like if you want to get some information about Locum A forms, select that. And this will then give you another overview of the process. And then as you can see, we've got lots of information available. So we've got user guides, videos, and a link to the FAQs. There's so much information available on the PCSE website. You can also select the resources section at the top. And then you can select whichever service line you need further guidance on. So if you want more support on performance services, that would be over here. And then you've got pensions, GP payments, and lots of other topics available. Thank you for attending and look forward to seeing you on the next session.